Welcome, everyone. Delighted to have you here today for our webinar. We will be starting in a minute or two, just waiting for folks to log in. In the meantime, please feel free to introduce yourselves in chat. Much of the benefit of this approach and our desire in this process is to learn from each other. So please introduce yourselves, where you're coming from, where you're logging in from, etc., and anything else you want to share, so that there is opportunity for intergroup chat as well as chat with us. But again, welcome. Again, welcome everyone. And please, again, as you're seeing in chat, please feel free to introduce yourselves. We'll start in 1 minute. Okay, I think we can get started. Please feel free to continue introducing yourselves for those of you as you've joined. Welcome, everyone. My name is Ken Spero. I'm the president and founder of SchoolSims, and I'm delighted to welcome you to our webinar today on mental health in the classroom. We are joined, I'm delighted to be joined by our guests and partners from William James College, Dr. Nadja Lopez, Executive Director of Behavioral Health Equity Leadership in Schools. And she's the executive director of at the James College Center for Behavioral Health. And she has been active in this area with a lot of deep experience in terms of counseling, working with kids, and bringing that to the table, both in terms of the content today, as well as in her partnership in developing the simulation. And Dr. Luba Feigenberg, who is an educator, a psychologist, and a facilitator, whose work has been, she's done a lot of research in this area, working with kids, working with schools, with teachers at many other high-end universities in this area. And we are delighted to be joined by them and to have their expertise in this process. Because for those of you who know about simulation, at the end of the day, our operating premise at SchoolSims is that experience is the best teacher. We know this from infancy. We know this is how, as human beings, we learn. Many of our most deep lessons that we go through life come from experience, whether we skin our knees, whether we burn ourselves on the stove, obviously things as simple as that. But in life, in the contextual elements of decision-making, and in particular in the classroom or in leadership or in counseling, the areas that we tend to focus on, we need practice with the decision-making because there is so much uncertainty. And there is no certainty, right? I mean, the fact of the matter is that being in the classroom, because of the nature of the student body, because of the nature of the other people that are affected and that are affected by and affect us in making decisions, the diversity of opinion, the diversity of needs, the diversity of requirements are so dramatic that it's really impossible to keep everybody happy. So you have to be able to make decisions and navigate in that arena. And of course, that's a very difficult thing to do with any, obviously with any certainty. Danielle, if you could forward the slides. So what we do with simulation is we know that experience is the best teacher, and we use simulation to approximate experience so we can make it scalable. So we can provide that opportunity for practitioners to have to practice, to engage in deliberate practice, and use that for development. because they can fail, right? That's how we learn from experience. It's from making mistakes. If you wouldn't put a pilot in a plane, you wouldn't put soldiers in the field, you wouldn't put a doctor or a nurse into a patient suite without hours of simulation. We feel the same applies for our teachers, the same applies for our administrators, because the stakes in our schools are certainly no less high. And so what we mean by simulation, next slide, Danielle, please, is going to be it's browser-based, so they are, again, eminently scalable, and we'll talk to this. But the idea is to be in a contextual scenario that looks like your classroom, looks like your building. It's not, of course, because we're not trying to recreate history, but it's something that's very recognizable in which you are going to make decisions and then have the opportunity to experience the consequences. Decision-making is challenging, but often it's the blowback that really messes us up. So that's an important component. And then there's the opportunity for reflection. And again, we'll come back to this, but the importance of being able to reflect on the experience, because without reflection, the learning from the experience can go right out the window. Next slide, please. And again, from a scalability perspective, it's so important that you meet your students where they are, right? When they're learning, they may be in the classroom, they may be in a university classroom, they may be online, they may be on their own and just need an opportunity for practice. So the simulations can be used synchronously, asynchronously, in-person, video, conference, doesn't really matter. Depends on what the needs of the student are and the opportunities with them from a logistics perspective. Next slide. Yep. So with that in mind, all of the simulations that we do, so when I mentioned that we're in collaboration with William James and with Nadja and Luba, our goals in terms of creating an authentic context that participants can engage with, we needed to come from practitioners. The experience that we're simulating has to be inspired by authentic experiences, so that when they engage in it, it's not their classroom, but it could be, and it's not their students, but they could be. And so we use video and text, but that's inspired by the experience of the collaboration partners that we work with. And in this case, dealing with an issue like mental health, the more we learn, the more we know that we don't know, and in the diversity of our children, but also our own mental health because of the challenges, whether it was COVID and everything that has followed since. It has not gotten easier to be a teacher and these challenges, but we still have to deal with our kids. And so the opportunity to engage, to understand, to reflect, to explore, to have some humility and ask questions, right? To realize that I can be uncertain. I came across a quote that I really thought was compelling. Uncertainty is the flip side of uncertainty is opportunity. As soon as we're certain, opportunity ends, right? So uncertainty can also be a good thing because it allows for possibility. And so with that in mind, I'm delighted to hand it over to Dr. Lopez and Dr. Feigenberg in terms of walking us through some of the issues from a mental health in the classroom perspective, and then we'll engage in the simulation.
Great, thank you. Hi, everybody. So as Ken was saying, Nadja and I come to this work with a long history of working with young people and providers around mental health, and particularly doing that work in and around schools, because we know that schools are where young people spend the majority of their days. Even before the pandemic, there was a concern about the increasing rates of child and adolescent mental health challenges. And what we saw in the pandemic and in the years following is that there's been a dramatic increase, both in the severity of mental health challenges that young people are facing, as you can see from some of the numbers here, and also in the prevalence rates, the number and percentage of young people who are experiencing challenges at all. If you can go to the next slide, please. This shows the percentages of young people who are experiencing persistent feelings of sadness or hopelessness in the past year. And what you can see is that overall 42% of young people, so almost 1 in every 2, and that rate is almost double what it was before the pandemic. So we're seeing really dramatic numbers and percentages of young people who are struggling. That's true across all racial and gender identity and sexual orientation groups. And we also know that the rates are increased in groups that are marginalized in our society. Thank you. We also know that working with and beside and on behalf of young people who are struggling is very challenging work. Teaching is very hard. Supporting young people who are struggling makes it even harder. The RAND Corporation does an annual survey every year of teacher well-being, and they have in their 2023 report released results that show that teachers are experiencing more job-related stress, difficulty coping, symptoms of depression, and burnout more than any other working adult. And so we know that when we're working with teachers around classroom mental health, we need to be considering both what's happening with the students as well as what's happening with the adults themselves.
Thank you, Luba, and welcome everyone. We're so glad to be here with you sharing this information because, as Luba mentioned, even pre-pandemic, there were a lot of struggles that we were encountering with youth mental health, and post-pandemic that has really been noticeable in acuity, in the severity, but also in now that we're dealing with different presentations that aren't quite as clear as perhaps what we thought. So there's a new approach that we need to take rather than really following that once a week office model. We really need to think about how to support student mental health from more of a public health perspective. So the Center for Behavioral Health, Equity, and Leadership in Schools was actually, interestingly, in terms of the timing, developed in starting in 2020 and more consistently so in 2021. So we have grown up, if you will, through the pandemic, really on the ground with what students are experiencing, what parents are experiencing, what teachers are experiencing. And so we decided to follow more of a prevention public health approach where we have academic programs and learning communities, district consultation, and of course, research that supports and feeds all of our programming. Next, please. And this is our model in essence. We believe that we cannot take a look at how to support student mental health if we're not taking a look at the intersection between behavioral health, DEIB efforts, transformative social emotional learning, and leadership. As Luba mentioned, we really have to pay attention to both the adult and student well-being component of things. And we believe that leadership, direct engagement in long-term, in-depth training is the way to go. And so to that end, we had the opportunity to work with Ken previously and learn about how much folks who were going through a leadership program really enjoyed that sense of feeling like they're making decisions in the moment, but not having the pressure of the consequences of a real life situation. So we decided to adopt that model of using a simulation to really mimic what it feels like for a teacher to have to pay attention to the whole class mental health while 10 different things are going on at once, to really make very quick decisions, to really be able to identify things quickly, which we know is not an easy thing. And we really do need to provide a lot of support to our teachers for their own regulation, for their own well-being, as well as for student mental health. So that's how we came to do this simulation. Next slide, please. And Luba is going to walk you through a bit more about it and how we're going to show it to you today.
Great. So we're going to walk through the beginning part of the beginning part of the simulation so that you have a sense of how they are structured and formatted and what the experience is like. And there will be moments when it pauses, the action pauses, and you as the audience are asked some questions. And we're going to walk through that together as well. So first, you will see that when you're presented with a pause moment, The first question is always going to ask you, the respondent, how you are feeling and what is coming up for you in the moment. We've done that intentionally, again, to focus on the adult social emotional capacities and the adult mental health in the situation, to validate that and to bring it into the conversation. And then you'll be presented with a series of options about how you might respond to the situation that has just happened. There will be a Zoom poll for you, and we'll invite you and really hope that you'll weigh in on the choice that you would choose to move the simulation forward. We'll pause after each one of those polls to have a conversation about why you wanted to pick one of the strategies over another, and to have some discussion about what the implications and thought processes behind each of the choices will be. We'll pick the one that gets the most votes and move forward in the simulation. And we'll be able to go through that process. We're hoping somewhere between 2 and 4 times, depending on how the conversation goes. So we're excited to engage with you in this process and look forward to hearing your thoughts.
Luba, before you open up the sim, can you also describe how you blend it? So, and kind of what is the student experience when you're using the sim, the wrapper, the wrapper, if you will, the combination of the instructional components with the experience, just to tee that up for as if this was a class?
How we've used it before.
Yes.
Yes, absolutely. So Nadja and I have used this simulation and others. The one that we're watching today, we are using currently with students who are part of a graduate certificate program in classroom mental health. And so we watched it all together step by step as we are doing partially today. And what we did was we had, after each piece, we had our students who are classroom teachers pick a strategy, pick the option that they liked best. And for everybody to see, we all proclaimed our strategies to each other, and then had a conversation about, as I said, the thinking behind that strategy, some of the pros and cons of different strategies. When there was disagreement in the group, we really encouraged people to ask each other questions and try to understand different perspectives on why one option might be seen as preferable to another. And then we gave people an opportunity to change their thinking if they would like. And we voted again on what the strategy to move forward was. And then we moved forward with the one that got the most votes. And as we go through, there's also opportunities built into the sim for there to be feedback about the strategies that have been chosen, giving a little more of our thinking behind what some of the potential implications might be.
Welcome to the Classroom Mental Health Simulation, created by SchoolSims, together with William James College. Select the next button to begin.
In this simulation, you'll play the role of a 7th grade teacher who has students with a range of academic and social emotional skills. You will be presented with scenarios and make decisions that will determine how the story unfolds. Your choices will draw on your self-awareness, your social awareness, and your sense of judgment. You will also have opportunities to reflect on your course of action. This simulation is designed to be a catalyst for dialogue with others and a prompt to consider your orientation and decision-making biases. At the end of the simulation, you will be provided specific feedback on the choices you made in a feedback report. We hope this experience will offer you some insight to apply in your practice.
Simulation context. Your class this year has 24 7th grade students. It's the end of September and you're still getting to know your students. They are fairly typical as a group, though there's quite a range of academic and social emotional skills. There are a couple of kids in the class who are having a really hard time maintaining their regulation in the classroom, and they seem to be taking a lot of time and attention from the group as a whole. There's a student coming back from a psychiatric hospitalization and you're supporting her re-entry plan. Several of your students receive school mental health services. You notice that some students are having a hard time working in small groups. They struggle to stay on task and work through challenges together. Some students don't seem to get a grasp on the instructions and keep asking for clarifications. Other students disengage during work time, putting their heads down on the desk or frequently leaving the classroom. You're starting to feel like you've missed your chance to set healthy routines and habits, and you're worried about how to set norms and expectations that encompass all the diverse needs of your students. The next day. The next day, during advisory, you give your students an opportunity to complete a survey and share anonymous feedback about what's going well for them and what they'd like to see change in the classroom. You review the results at the end of the day, and a few things stand out to you. Many students are glad to have choice on their seating assignments. A few students are happy to have friends in the class, but some mention that they don't feel like they can trust other students and feel uncomfortable sharing things in the group. Some others are feeling very anxious about the new project you've just presented. One student reports that there's a rumor that someone in the class is cutting themselves. How are you feeling and what reactions are coming up for you? Your response will be saved and made available at the end of the simulation.
So as I mentioned before, in each pause moment, the first question is to have you, as the educator, take a minute to pause and think about what feelings and reactions are coming up for you. We invite you to put your thoughts at the chat, or to say it out loud, or to jot it down for yourself.
Don't have text.
Yeah, this is Yair Maman from Tour University.
Go ahead.
You know, it seems like it illustrates interesting scenarios with just the language, regulations, and all of that. We work in inner city, high-need school in New York City. I'm at one right now. It seems like the counselor trainees would need scenarios that are more with less textbook and more real life kind of drive to it, if I explaining myself correctly.
You're talking, so in terms of the scenario itself, and there's, we're not, just to be clear, I mean, and again, I don't want to get distracted in the nature of the exercise. We're not trying to be, this is not the experience. This is just an experience. This is a classroom in which a challenge relating to mental health manifests. So in terms of that, there are others, absolutely. And so that's a discussion for another time. But in the meantime, try and think of this in a manner in which your students may engage with this scenario. And the opportunity in this modality is that they may relate directly to the scenario, or they may see dissonance with another scenario as you're describing, but then there's an opportunity to discuss what's different. Why is that what you're describing, what you're seeing, so different? And what are the issues that you would see there? The goal is really to provoke a discussion. The goal is to have an experience, and how that manifests can obviously be determined by how you facilitate it. But again, we can come back to that, but really, looking at that, specifically responding as some have, what are you feeling at this point in this scenario? What you've observed, where you are as this teacher? Again, we set the scenario up as you're the 7th grade teacher. We don't tell you much about you because it's you, right? You're making the decisions in this role. And so how are you feeling? How are you imagining your students are feeling? I mean, it could be you, or it could be thinking about this through the lens of your students. How are they feeling at this moment, given where they are and the fact that now they've got to navigate? And kind of just to have that emotional granularity to validate how they're feeling, and then be able to move into decisions. Sorry.
Thanks, Tim. No, thank you. And it seems that there are some responses in the chat that have been put into the simulation as well. So feeling overwhelmed by the challenge of accommodating all the needs, feeling unprepared and nervous to deal with a student who might be cutting. Some resonance that this is a fairly normative way for the school year to start, with some concern, and a comment around, I'd want to talk to the kids more about routines and procedures to help them and start to feel better about the environment. So thank you for sharing those, and they're very relevant to to the responses that you get to choose from next. Again, more feeling of overwhelm, stress, and worry, and a question of how to focus one's energy as a teacher. Maybe we can move
Given
forward.
this information, what would you do next? Find a time to hold a classroom meeting to discuss some of the themes and concerns found in the survey with the whole class. Talk to the school counselor and see if they can come in to do a talk about mental health safety. Remind students that the expectations are higher in middle school and that independent skills, like time management, organization, and planning are important parts of learning. Find time to check in with students individually to see how they are doing and in the hopes that you can find out which student might be cutting.
So we're going to invite you to participate in the poll to see which path would you choose.
And it looks like the poll has 5 choices. We only have 4 choices. So pick the one that corresponds with the one that you would
Well, if you'll
think is the
forgive me,
best next thing to do.
if I just jump in, if somebody doesn't see the choice they would want to make, they can choose 5. But then they have to share what that is. Because again, the goal is the critical thinking component, right? We're still going to constrain. And as in life, right, you can't always do what you may want to do due to constraints in the circumstance. So often that's why we have the 5th option there to allow for that space, because maybe somebody does have a unique or different way of dealing with things. Okay, let's talk about it. But you can't do it. And then to have at least open that up to, so again, that's why we do have the extra one there. So
Thank you.
Okay, so it looks like we have the majority for the first one, which is to hold a classroom meeting to discuss the survey with the class. Is there anyone else who didn't get to vote who might want to put in a vote? Okay. All right, so shall we go ahead and choose then the first one?
Do we want, Nadja, before you do that, did we want to ask people if anybody wanted to speak on behalf of the one that they chose? It looks like there are some people who chose option 2, talking to the counselor, and maybe 1 or 2 people who chose reminding students that the expectations are higher in middle school. No one chose finding time to check in with the students individually. So if anybody would like to share why they chose the one that they chose or why they didn't choose a different one, we'd love to hear some thoughts that you have at this point. Again, in the chat or come off mute.
So we have a comment that for this one, the person chose number 1, but in reality would probably do both 1 and 4. Okay. So that would be a combined approach. Oh, somebody agrees. Agrees with the combined approach. Choosing 3 as next step because clear expectations are important, and then would follow up with a class meeting and individual conferences. So we're having sort of a combined approach, but in different order. And one of the things to remember is that, again, there's no right or wrong answer associated with these. And part of the conversation that we had with our group was really to think about why would you choose one thing over another as a first step? Would that change based on what age the student is, right? Not all of our teachers teach 7th grade students. Some taught elementary and some taught older students. And so we also considered whether the order or the choices would change based on age range. But the conversation was incredibly helpful just to think about the options presented. Okay. Should we see what happens then when
Let's see
number
what
one is
happens.
chosen?
How will you structure the classroom meeting? Save the last 10 minutes of your next class to tell the students you read their surveys and ask what else they would like to share so you can get more specific information to plan your strategies. Start your next class with a review of the school code of conduct, definition of relational bullying, and the norms and expectations in your classroom. Ask the counselor to join you to co-facilitate the conversation because your concerned students might share more about their mental health challenges, including cutting. Set aside your next class block to engage students in an activity where they can talk with each other and brainstorm solutions for the themes that came up in the survey.
When we did this with our students, we counted down from 5 when they were making their choice the first time, which they really did not like. And we talked about the pressure of time, partially to your point in the chat, Ken, about, yes, there are lots of situations where we want to, ideally, we would do many things. And in the moment, we only have time for one or half of one. And we have less than a minute to make a decision. So appreciate the stimulation of that urgency in this exercise as well. So in this one, it looks like the most popular option was to ask the counselor to join you to co-facilitate a conversation with some concern about what mental health related topics might come up. The next most frequently chosen is setting aside a class block to engage students in activity where they can talk with each other. Then starting the next class with a review of some norms and rules and policies. And then a small number of people for saving the last 10 minutes of the next class. So again, wondering if people want to chime in as to why they chose to move forward with the choice that they did make. Some of the things that maybe you were weighing between the options.
I'll share. I'm a former 6th grade teacher in a middle school, so there were 7th graders and 8th graders around. I never felt, and still as a university person, don't feel really comfortable handling the growing challenges, mental health challenges that students face. So I would always feel it necessary to reach out to folks who were in student support services. And a lot of times after the fact, I learned that there were some heavy mental health issues happening in my classroom. So even in the first scenario, I would always reach out to someone else who perhaps has a bigger picture of students in their lives, and then certainly access to the tools and strategies to support young people who are in crisis or just kind of trying to navigate adolescence.
Thank you for so much. It's good to hear your voice, and thank you for sharing that. We heard that a lot from our teachers as well. Having a concern of maybe going about it not quite the right way, or maybe not having the right resources to be able to support the conversation was one thing they worried about in that choice. Yeah.
Somebody else chimed in the chat about a similar feeling of better to have a colleague to help assist in the effort. Somebody also in the chat speaking on behalf of the 4th option, because it specified that it had a lot of time dedicated to the activity, and that felt important. It also felt proactive and positive and brings the students into feeling like they can be part of making the environment better for each other. So thank you for sharing that in the chat, Ray. So should we move forward with choice 3?
Sure.
All right.
Counselor's limited availability. The counselor says she would need to meet with you first to better understand what is going on before being able to talk with the class. Based on her schedule, she wouldn't be able to come for at least 2 weeks. Feedback. In this situation, you were asked about how to use and share student feedback to address student concerns. You were challenged with responding to several different student concerns, ranging from lack of trust to not understanding assignments to the potential of a student engaging in self-injurious behaviors. Understanding how to respond and with what urgency can be challenging when presented with such a range of difficulties, especially about how to manage this information with confidentiality, promptness, and respect for student privacy. This scenario also posed the challenge of understanding what you can do within your role as a teacher versus what needs to be handled by a mental health professional in responding to student concerns. Collaboration with mental health professionals is always important when self-injury or other acute mental health concerns are reported. As a teacher, even with his complex range of concerns, there are certain things you can do to promote the emotional health of your class. First, an understanding of the interconnected nature of emotions and learning is critical. Students will not be able to fully engage with assignments, learning, and each other unless they feel emotionally safe and connected to each other and with you. Creating emotional safety means an intentional focus on how to set a classroom climate that promotes clear structures, expectations for engagement, and how to support and hold accountable for maintaining emotional safety. This is done by dedicating intentional time and space for developing shared language, opportunities for group discussion, and engaging students in the co-construction of a learning community. Project due soon. The end of the quarter approaches, and the project completion date is nearing. You have gone through different parts of the assignment with students. You've encouraged them to ask questions and set up time to talk with you if they have individual difficulties, but so far no one has. There are some students that are refusing to do it or are having significant difficulties, including Cade. Introducing Cade. Cade is a 7th grade 13-year-old non-binary student. They live at home with their parents and an older sibling who was in your class 3 years ago. Their grades are mostly A's and B's and they're in school most days, though sometimes they arrive late to your first period class. You find this student to be insightful, well-behaved, and respectful. They participate occasionally and can work in groups, though they don't take the leadership role. It is now 2 days before the deadline and during independent work time, you go around to check in on students. When you get to Cade, you ask how the assignment is going.
I don't understand what I'm supposed to be doing, but it doesn't matter because I'm going to fail anyways. I need an extension. I mean, if I don't get this, I'm going to fail.
How are you feeling and what reactions are coming up for you right now?
So again, feel free to put in the chat or shout it out to us or write it down for yourself. Really want you to think about what came up for you regarding the situation, the student. Not an unusual response, not alarming, okay? Someone is writing, I'm guessing this is probably a pattern with Cade, so I would have anticipated it most likely. would want to probe further? Would want to probe further to find out why an extension? And compassion, I'm thinking about what I might do to alleviate Kate's concerns. Okay. All right. So why don't we do the next choice and see where that leads us?
What do you do next? You tell Cade that they can have one extension, and that's it, as it wouldn't be fair to other students who have kept their deadlines. You tell Cade that's not true about failing, and they might just be feeling nervous. You remind them about how good their grades are and how successful they have been in other assignments. You say to Cade that you hear this is feeling challenging for them and ask where they are feeling most stuck. You tell Cade you're glad they asked for help and they can have as many extensions as they need.
All right, we'd love to see which ones you pick.
Ooh, and I think maybe we can try the experiment of counting down from 5 to 1.
All right, you do it.
Here we go. 5, 4, 3, 2, 1. Go. Let's see what we have. Okay. So it looks like majority was, let's see, you say to Cade that you hear this is feeling challenging and where they're feeling more stuck. We have another choice for number 2, that's not true about failing. They might just be nervous. You remind them about how good their grades are. And a choice for telling Cade that they're glad that you asked for help and can have as many extensions as they need. So that's a big range in terms of different ways to go. And I wish we had more time that we could discuss this, but we're kind of leaving you on a cliffhanger because from here moving forward, it gets tricky in the subtleties of language and what you choose to do. And then it also becomes interactive among the students. So where the students are saying different things to each other and how you handle that right in the moment. And then it moves on to parent interactions. So hopefully this gave you a sense of what it's like and excited for you to see it to the end. I'm going to turn it over to Ken.
Thank you so much, both Nadja and Luba, for that. And if you are interested, we try to be sensitive to people's schedules, so to kind of bring some closure by the top of the hour. But if you have questions, and we'll have some time for Q&A, but for some additional Q&A to stay beyond 4 o'clock, if you have that flexibility, we'd love to continue chatting. But we did just want to be able to allow for the experience of this, but given that many of you are practitioners from working with teachers, the opportunity to think about how you might use this and the manner in which it is being used. But obviously your situations are different, and the opportunity with this modality is the flexibility, and again, most importantly, the scalability. And so one thing I wanted to highlight, we didn't really spend time on it, but you did get a chance to see the feedback, the first piece of feedback, right, which was a feedback on your decision, on our decisions, if you will, right? So that was just some insight for reflection, which would be an opportunity, and as Luba had described in the beginning, an opportunity to explore, well, here's some of the feedback, here's some of the reflection. How did that align with what you were thinking? What are some of the implications? Again, it can be provocative because students may feel differently, and get them talking. But again, the important component is the reflection, which is a key component to the simulation experience. And often we hold off the feedback until the end. So we mix and match, based on the needs of the students. But when they get a report at the end of the simulation, which is more summative, this is what it can look like, in which this is the PDF form of it at the end of a sim. But here's where there was that open-ended opportunity for capture. This was in a parent-teacher conference sim, where there are some considerations that you see here in terms of what you may be thinking in this idea of what information would you bring to a parent-teacher conference, and then capturing what their response was. So again, that opportunity for further reflection, And then, and the decisions, we remind them what the scenario was, what the learning objective in that scene, their choice, the other choices, and the feedback on their decision to, again, allow them to reflect on the full flow, right? We often hold off on even not feedback per decision, even in this format, because we want them to live the life, so to speak, right? There's no one and dones. There's always blowback. There's always consequences that happen, and often it's good to experience the consequences as well, and then reflect upon the entirety of the experience, which also is why you didn't see a back button in the sim as we were going through it. There are no mulligans here, no do-overs. If you want to have another experience, play the sim again, which students often like to do because they get the entirety of the experience rather than one decision, because again, there's no one and done. So just to give you a sense of what that feedback report can look like, but when you're deploying, again, from that scalability perspective, it is accessed through a portal which you would control. So the library, in the subscription process, you would have control over what sims your students see, when they see them, for how long they see them, etc. And you manage it from this perspective. And so you manage your users, how you share the simulations, the links, because that's all it is. It's the links, so you can again do them synchronously or asynchronously in the classroom or online. You can view the library as you want to explore which simulation you might want to use or which you might want to blend into a particular course, and you can filter based on standards, based on well, I want one with a parent in it. I want one that is specifically oriented to, you name it, and you can find in terms of what's in the library to be able to deploy. So in this way, you can harness the opportunity for experience in your courses or in your PD aligned with either the content, aligned with the nature of the problem, aligned with the context of the problem. All of these things can influence and frame, if you will, the way a student will experience it. And this gives you the flexibility to deploy where and when you want, as often as you want, because there's no counting. So in terms of bringing out this opportunity for experience, being the best teacher, and to provide scalable experience, this is the nature of the experience that you can have in the utilization of that across your various programs. And really just, we have a library of Sims. This is part of the Teacher Sims library, the Leader Sims. We have an entire leadership library. We also have a growing Counselor Sims library, dealing with these, a variety of topics. And again, we are delighted to hear, and to the professor from Turo who mentioned, another aspect of this. There's no shortage of experiences that we need to give experience with. And so we're always delighted to hear from practitioners interested in participating in the development process, in which we can have these manifest. And so there's always that opportunity as well, because that's where the simulations come from, and that enable us to keep them authentic so that students can relate to them both in what they are and what they're not. Again, because once they're engaged, because of the power of stories, the dissonance is often constructive, because it forces them to think about, why is it different? Why is my context not that way? Why is the climate in my building or my climate in my classroom? Did I miss something? Or no, I got this covered. Well, okay, you got it covered until you don't, right? So it's that opportunity to reflect on and understand those underlying elements and reflect upon them in a peer-to-peer way. When they're done synchronously, the opportunity to learn from peers, as both Nadja and Luba pointed out, the way they're facilitating, and the opportunity for the students to learn, not just from you, but to learn from each other, can be very powerful, because that's in the action, right? They're learning from the actions of others, what went well, what went poorly, and why. And where is that?
Ken, I'm so sorry to interrupt you, but I think others might also be seeing their screen as blurry. I can't quite read the words on the screen. I'm wondering if we could maybe reload the slides so that folks can see exactly where to go for the topics.
Stop sharing. I will let Danielle reload. I'm sorry, my internet must be acting up. The gremlins are conspiring.
Yes.
But thank you for interrupting, and please feel free to interrupt with other things too, in terms of, and it was delightful to see, to hear and experience, and it's always exciting to experience from the standpoint of doing simulation. I've been doing this for a long time, and I have, in working now in education, I have learned a fair amount of, I'd like to think that I've learned a fair amount of humility, because I know what I know, but I don't know what you know. And there is so much to know. And so the opportunity to hear from others when they see the same thing is just a wonderful opportunity.
Well, I think one of our key words in the graduate certificate is how to use curiosity as a way of learning. And, you know, Luba and I were similarly concerned. We thought, you know, we're working with veteran teachers. They have experience working with many kids. And we were concerned about, will this be something that will help to think about mental health in a different way? And, you know, it was really amazing for us to, and you know, privilege for us to be able to sit with the teachers and hear how they thought about it, because there were a lot of things, there were a lot of strategies that they had used. What we noticed though is that there are some strategies that are either not working anymore or that are not providing the equitable experiences that there should be, or there's a real push and shift for more tier 1 interventions to happen in the classroom level rather than the, you know, thinking about a referral as a first option. And so we were able to really think about not only that immediate situation, but also what are the protocols currently in existence? How are they helpful or not? Who knows how to use those protocols? Who's involved? And there was a lot of time that we spent on how are you feeling in the moment? You know, how do you maintain your stamina when 20 of those decision points come up for you throughout the day? And so it wasn't so much about what is the one right thing to do, but to think about how do you take a look at setting the learning conditions? What strategies do you need for yourself as an agent of co-regulation when you're managing student mental health? What strategies can you use? And then also, you know, how do you follow up when things don't go exactly right? And so we kept talking about co-regulation, we kept talking about curiosity, and we found that despite the veteran status of most of our teachers that we had in the group, they learned from each other so much and really thought about the classroom and systems level in a different way. So that was exciting for us to see.
And I imagine that helps with their mental health, right? The de-isolation, the feeling like you're not alone, let alone actually processing the specifics, but just having that opportunity to be able to engage in that way.
100%.
Just one real quick thing before we turn it over to Q&A. It's just to really to let people know, I think it's the next slide, Danielle. If anybody's interested in trying this out, we'd be happy to provide access to the simulation and access to the portal to use them for the rest of this semester. So you can do kind of a mini trial. So please let us know if that's of interest. Obviously, you can use the QR code. And we'd love to hear from you. And with that, I'm sorry to interrupt you, Nadja. Back to anybody has questions, please feel free to open it up at this point to questions that you have.
Luba and I are also happy to communicate offline. So if anyone is interested, I'm going to put our email addresses in the chat. And we would love to hear from you too. So feel free to email anytime.
And some other resources were shared in the chat as well. So please feel free to take advantage of those. Thank you for attending. Anybody have questions or experiences you want to share, or things that, ideas that you want to, things directly to either of our panelists or others? Hey, Aaron.
Hi, how are you? I just can't say enough of the method and process in which you take in using these simulation. It only validates the work that I've been doing with aspiring leaders over the course of the last 3 years. The things that stood out to me today is that the process, this experience of the simulations, it really pushes deep dialogue among colleagues to really think deeply. It offers them the opportunity to really think about their learning and how they would apply it to practice. The other piece of gaining the feedback, it pushes them to say, what does it look like, or what's the feedback that I got from this? I love the fact that Ken said, always do it again, play it again, and I say that to my students, like, take it and play it again. But I think the bottom line that you walk away from these simulations, as you both pointed out so nicely today, is the opportunity for reflection. And if we don't, in my particular position, develop strong, reflective school leaders, then the lack of impact won't be there. So thank you so much. It was very, very informative.
Erin, thank you for that. And you made me think of something that was so important that our teachers said to us, which was many of them said they would not feel comfortable doing this kind of exercise with their administrators. And so part of what we're doing as a systemic intervention is including administrators in a 9-month-long training experience. But this also brought up issues about the lack of psychological safety, within the different levels. So it was really important for us to know that, and for us to work with administrators around that too.
Well, I think one of the things that our students, we're a principal preparation program, but in doing it in the safety of our cohort environment, the next statement many of them say is, I want to do this with my intern mentor. I want to see what a current practitioner and how a current practitioner might answer these questions. So we push them to say, take it and do it, because it will continue to make a difference.
Thanks, Sarah. Carol, I think you had your hand up.
Yes, my question is really around the number of simulations you have, and I suspect it's sort of like a subscription service, and you kind of buy access or whatever. But is there a way to sort of go through all of the simulations and decide which ones are most appropriate for your course? I mean, how does that all work?
Okay, so real quickly, it is a subscription and it is a library. And again, we leverage the idea that experience, there's no shortage of experiences that are required. And so we try not to separate the library, if you will, so that you have the flexibility, because you may not realize something may come up during the course of the year and you go, I think that a sim on that sim would be really good, but we didn't subscribe to that one. So we want to be able to maximize your opportunities, so to speak. And once you have them, then you can play them, and you can certainly view them, and you can go through them in advance, and we can share with you some additional information. But it's important to note also that the distinction between what you're teaching and a sim is that in experience, we're not simulating standards, we're not simulating competencies, we're not simulating, particular instructional elements. What we simulate is time. And so what happens is that the timeline that we simulate, that we capture, may embody a series of standards or competencies or course topics that you have. So the sims may actually apply in different times in different places. And again, that's something you'd have to look at. So this was a long-winded answer to your question, which is, yes, you can look at them and explore them to see where you want to apply them. Absolutely. And then again, we would also help give you, from our perspective, how to look at the Sims so that you can think broadly about the way they can apply across different course topics. So
Perfect.
hopefully that
Good.
wasn't too long-winded.
Great, great. Thank you.
Any other questions? Well, we have passed the top of the hour. So we want to thank you all very much. Please feel free, again, to reach out relative to getting access to the sim, the portal, to try things out. Also, if you're interested, as Carol just asked, in our simulation overviews, we do have kind of one-pagers that really provide insight into what's in each sim. You know, what level classroom in the teacher sims, what the time of year, the nature of the problem, the context that it takes place in, who are the key related characters that you're going to be interacting with, who's in that ripple effect, what are some potential trade-offs that are at play, what are potential topics for discussion that you might harness, and again, which of these standards are touched upon in that sim. So you get a one-pager on each of the sims, to at least get that insight without playing them, to see what's in them. So feel free to ask for that. But we look forward to seeing you again at a further webinar. You can access our past recordings. If you're interested in seeing other examples, we did Respect in the Classroom was our last teacher sim webinar. We will be doing more, so please watch for those. But we're always interested in talking. So thank you for your attendance. Thank you very much to both Dr. Lopez and Dr. Feigenberg in terms of both their expertise, their time, and their partnership. And again, we'll stick around if anybody has additional questions, but thank you for attending, and all the best in the field.